My name is Joshua McClure, and I'm the CEO of Health Anonymous. We develop biotechnology to treat chronic conditions.
I'm Dr. Gary Newsom, MD. I'm here as the Executive Vice President of Medical Operations for Health Anon.
My primary motivation, what I get up to do every morning is, try to change the world in a revolutionary way that's going to make people happier and healthier.
What we're intending to do is use two older medical procedures, stellate ganglion block and therapeutic plasma exchange, in novel and new ways in order to help those that suffer with PTSD and alcohol use disorder.
The novel procedures that we are developing have actually been around for quite some time. In the case of stellate ganglion block, it's been around for about 100 years. It's just never been used effectively for PTSD. A couple of new studies have come out that showed us how to do that. In those studies, there was a case report of someone no longer being addicted to alcohol, just out of the blue, right after the stellate ganglion block.
Stellate ganglion is a patch of nerves that come down on either side of the voice box and are localized right here at the base of the neck at about cervical 6 and 7. And what we're doing is we're injecting bupivacaine, which is a lidocaine type deadening agent.
The bupivacaine then travels up into the brainstem and down into the rest of the ganglion to put your sympathetic nervous system, your fight or flight nervous system, to sleep. And for the first time in that patient's life, that system is now resting. And so that's the hypervigilant nervous system that's awake even when you're asleep. And so this is the first time it's had a chance to reboot and reset itself. When it comes back up, what we want it to see is a peaceful environment.
We can do this in about 15 minutes in the hands of a good anesthesiologist. We localize where you're going in with ultrasound or with fluoroscopy, but many of the guys that I've talked to laugh at that and say, I could do that in my sleep. Anyway, they aren't.
Basically what happens with a stellate ganglion block is it's sort of like rebooting your computer. As soon as you see you've got a problem with your computer, you try a couple of things with it. If that doesn't work, you turn it off and you turn it back on again. And that's basically what a stellate ganglion block does, is it resets your sympathetic nervous system.
We know now that it works in about 70% of veterans who have severe PTSD that won't respond to anything else.
It literally takes about 15 minutes, the procedure itself. We keep the patient in the clinic for just a little while, about an hour, just to review, make sure they're okay, make sure everything's going. A complication rate is extremely low, but we just want to make sure that everything's good before we let them out the door.
We're at the stage now of beginning to test our block on those not only with PTSD, but having an alcohol issue as well. That's about 40% of all of the veterans who suffer from PTSD. We think that treatment with the block will help both of those disorders.
The other procedure that we're working on is a therapeutic plasma exchange.
The whole blood has plasma and then cellular elements, red cells, white cells, platelets. So if you separate out the cellular from the oil, what's left in the oil is plasma. So the whole blood goes through the machine. Here in this machine, we're able to separate out the plasma, which is the oil in which the cells are swimming in, from the cells. And that's the white cells, red cells, and platelets. And then the platelets and red cells and white cells go back in. But the plasma gets discarded. So we're able to infuse about 3.5 liters of new plasma in one exchange. That's what these are called, as an exchange. The thing is, it's just a circuit, and we're able to separate out plasma from the whole cells and then replace the plasma. But the type of plasma that we're replacing, that's the key.
The proteins and enzymes in your plasma are what operate your body. They do all the work. And so bringing in healthy plasma is something that no one has done before. No one has curated plasma and selectively targeted plasma to sick people. Now that we know absolutely with certainty that plasma has something in it that's personalized, and it's different at various different health states. Now we know that we can have a stratification of plasma products, right? So right now, what you would get if you went to the hospital and you got fresh frozen plasma is just generic fresh frozen plasma. Where did it come from? Well, I'm not sure. It came from the big vat. The plasma is so diluted, there's so few proteins and so few enzymes in it that it's not really therapeutic. It's really just effective in that it's diluting what bad plasma is already in a patient. So I guess to summarize, I would say stellate ganglion block is a reboot of the computer, and therapeutic plasma exchange is reinstalling the operating system.
Our goals moving forward really relate to something very subtle, that we're checking protein profiles before and after these procedures. We all have in the plasma a profile that is different from minute to minute, thousands of proteins. But we know now that if we collect those and use big data, we're able to project exactly how those proteins work and look at one point versus the other. What we're hoping to find is that there are markers that are able to tell us more about the genetic components before and after these procedures.
And so we actually do a profile of the person. We look at their plasma before and after, and we say, okay, these are the problems with this plasma. Then we go find someone who has the right strengths in their plasma to treat that person.
If we intervene, especially with novel proteins in the form of plasma, then we're hoping to find some difference in the signature between here, and hopefully something in the epigenetics or the proteins that can help us in finding cures for chronic disease and inflammation.
What we're hoping is that the proteins will create new cells. The new cells will act almost like baby cells, and they will create new proteins. And so we'll have created a new cycle. We'll have broken the old unhealthy cycle, and there will be a new beneficial cycle within that person. This is called regenerative medicine. So we're hoping that it's actually regenerating that person from the inside out. We're going to be rolling out the commercialization of these procedures in Dallas-Fort Worth, which is a giant commercial center, giant metropolis. The target addressable market in the United States right now, with the under-addressed state of this disorder, so not very many people are prescribing anything for PTSD right now, or alcoholism, is $41 billion. This is the equivalent of $41 billion right there, is about the size of a major pharmaceutical company. The lifetime value of a stellate ganglion block patient is about $8,000. The lifetime value of a therapeutic plasma exchange is $45,000. The target addressable market in just the DFW market is $1 billion. All over the country, all over the world, people are going to see that there's effective therapies now. We're going to publish it through Annalise's reputation, through Stanford's reputation. We're going to get this out into the world. And so anyone who can do a therapeutic plasma exchange, which is just about any outpatient procedure, a physician's assistant or a nurse, and then any anesthesiologist who can do a stellate ganglion block will be able to do it exactly the way we're doing it, and we can show them how the whole thing works.
These therapies that we're planning to test and study, and I hope, find to be much more broadly applicable than only to these veterans. We may end up being able to help hundreds of millions of people. And I think that's where this company's going to go. I think this company's going to be huge.
This is really a calling, and it's at a deep level. It's almost at a spiritual level to be able to participate in something this broad, this deep, and that could influence and help so many people. I think our greatest hope is that at the end of this, at the end of the day, that we turn around and realize that we've given back, that we got here and we're given a lot, and some of us were in that darkness, but that we remembered those that were there with us, and that we're trying to do something to reverse the processes that put people there.
Tell people about this. Tell people what we're working on. Tell people there's a chance to make a difference right now. Thank you so much.